Okay guys, this is the progressive underload for the Jefferson curl. This is how you start to build it up. So the way to fix your back, or at least one of the ways that I work, is never push through pain and never enter movements that cause pain. Okay, sometimes you say, okay, I didn't push through pain, but a movement set me off. The thing to understand is when a movement sets off your back pain, this means that tissue is tearing generally, okay? It just might be the tiniest little bit of tearing where the annulus fibrosus, I believe that's what the outer compartment of the disc is called, might tear just a little bit, and the hernia is pushing out just a little centimeter extra, and that's enough to set off your nerve compression pain. Or it might be a strain in your back that it's just enough to set off that, or it might be a subluxation, a mild subluxation of a vertebrae that's out of place and is might be pinching. Whatever it is, it's generally some tissue that's tearing or something being compressed that doesn't want to be. So one, you need to not push through the pain, because every time you're pushing, you're just tearing, okay? The second thing is you never want to cause pain, or as little as possible. So you say, hey, I can't carry the shopping in at the moment. Hey, I can't pick that up. And these things can catch you off guard. That's why it's important to start developing a back pain system where you're mapping out where you are safe and where you're not safe. Oh God, that's going to cause me pain. Okay, I'm not safe there at the moment. I can't do that. That's why you need to apply the concept of Kaizen. Practice every day. What's more important? You have to say, my back pain is one of the most important things for me to fix. If it's not, then you're probably in the wrong channel, because for me, this is, you know, for most people is one of the most important things. It's probably holding you back. In any case, I'm blabbering on. The concept of progressive underload is really important. A lot of people are afraid of bending their spines in this way, and that's understandable because this is where the hernia will generally stick out, okay? But the dosage of the medicine determines whether something is therapeutic or poisonous, okay? So how much intensity you apply will determine whether the stress causes calluses to build or skin to tear, okay? That's very important to address this fear of bending your back, because I have some people with disc hernias, and I'm helping people with back pain and disc hernias every day, okay? All day, pretty much every day, maybe 6 or 7 days of the week. So forward folding is not inherently bad. It is bad when it causes you pain in the moment or slightly after that moment, like the hours proceeding, the days preceding. You say, yeah, that was too much for me. It mightn't even mean that you shouldn't do the movement. It just might mean that you went too deep into the movement, okay? So this is how we start to develop the Jefferson curl, okay? If all we can do is get to here and up, great. Coming to here is still creating a shear force on your back, a force that your back muscles and soft tissues like discs have to tolerate. So you're starting to rehydrate and create a little bit of force adaptation and energetic adaptation down here, okay? Even if it's just like this. You say, yeah, I feel safe here. Do that 20, 30, 40 times. Try and build up some temperature. Try and build up a little bit of fatigue, because fatigue is generally the physiological marker that adaptation is going to occur, okay? It's a stress that is generally positive, okay? So progressive overload would be, I start to go more and more. The further I go here, the more shear force runs through my back, the more it causes adaptation or fatigue, fatigue or adaptation. Then I use weights to overload it as I feel safer and safer with no pain. Progressive underload will look like this. I might have my hands on my legs here as I come down, so I'm actually taking weight out. I might bend my knees even more, and then I might come up like this. Down and up. Okay, progressive underloading means I'm taking weight out of the area. You might use a bed or something like this to practice going down. So I use as much as I need in my hands or as little as I need in my hands, depending on how your back is feeling. Generally, it might even take you just 1 or 2 sets of 20 to 50 reps to just get warmed up before you can start doing it, okay? So this is the progressive underload concept for back pain. If you follow my other morning routine videos, you'll see we want to get our spine moving in every direction, every single day. This will let you map out where you're safe today. It will also start applying force that your back is going to adapt to. Again, guys, Kaizen, practice every day. Okay, you have to ask what is more important than fixing your back pain. Very few things probably are. So practice, find that 30 minutes. Don't overdo it. You'll learn with practicing where you're safe today, and give it a few months of practice, and you'll really feel you'll start opening up new levels of your back here, okay? So my advice for you is, if you're not in pain and you're not causing yourself pain, start to develop this movement. Use the progressive overload or underload principle here, and you will create the adaptation. Please give my channel a subscription and a like to the video. Drop a comment below to ask me some questions. Let me know how you're getting on with this. I have all of this content for free on the channel. Anyone who has back pain, please help yourselves to it. Please ask me questions. I'm so happy to help you. I feel that if anyone is really stuck and they can't afford back pain coaching or how to get out of their back pain, I'll try and provide my whole system for free here. So use it to your advantage, guys, okay? Have a lovely day and peace.